delighted to introduce Emma Seddon, Steve's laser therapist, and I'm just come here today because Emma's laser therapy is being used, or laser therapy in general is being used more and more around the world to aid and alleviate chronic pain. And because we're focusing on chronic pain this week at Seed, we thought it would be a really good exercise to actually show you treatment. So Emma, thank you for talking to us, and can you just give us a little bit of a backstory?
Sure. So this is Mark. He sustained an injury around his ribs and his shoulders when he slipped on the ice about 1.5 years ago, and it's left some residual pain that he's not managed to shift at all. So we have been treating that initially every week, and we've now spaced that out, and he's feeling a lot better. But there's still a little bit niggles in certain movements, so that's why we're continuing to treat.
Okay, brilliant. So can you tell me technically how laser works on pain and injury?
Yeah, sure. So I am using light, various wavelengths of light and of different densities, and the light is being absorbed through the body into the cells, and they're converting that light into energy. And essentially the process behind that is to accelerate our natural healing. So our body will naturally heal itself. It's always rejuvenating and regenerating. However, when you have a significant injury, or you're suffering from stress, or there's a disease, or there's something else going on, that natural process gets sluggish, it slows down, it almost stops working. So the light, it acts as a catalyst, if you like, and reinvigorates those cells.
Okay.
So what we're doing is aiding the body to heal itself naturally.
Amazing, brilliant.
But speeding that up, if that makes sense.
That's what we see a lot in our world of complementary is bringing the body back into balance and enabling it to heal itself. So it kind of works on those same principles. What are the most common issues you see in your clinic?
Typically, it's going to be soft tissue injuries, joint pain and inflammation. That's when most people
Does that include arthritic pain?
Definitely. A lot of arthritic pain. So yes, all of the joints, as I say, sporting injuries, again, another typical, and all over the body.
So how long does it take to work?
It will be working pretty much instantaneously. You know, as soon as the light is absorbed, those cells are activated. So it works from day one. And it works on a cumulative effect. So obviously, the more treatments you can get done in a shorter time period, as soon as the injury occurs, the better. But that doesn't mean to say that you can't treat many years after. I have had clients come to me, an injury 20 years later, and they do still see results.
Oh wow!
It just takes a little bit longer. But
can you give us an example?
Yes, a lady who had suffered with a chronic sacroiliac pain for many years. I think just an injury, moving a bed or something, just never managed to shift it, and tried everything, every other therapy, and then came across my website and tried it, and she was quite amazed actually, with the results.
So am I right in saying that you can treat here, people can come to you, but they can also take a laser machine home with them? Can we see the machine?
Yeah, sure. So this is my machine. I can travel to clients' homes as well as them coming here. So this is the one that I would use within my clinic. I've also got my portable handheld machines, which I program, and then I send you home so that you can use them on a daily basis. So actually that makes treatment a little bit more viable if you need to have a lot of treatments in quick succession, so I can send it to you to use daily at home.
Okay. How long if you're doing it on your own at home, how long would the treatment be for?
It would be for a minimum about 20 minutes to half an hour a day.
Okay. Does it hurt?
No. Does it hurt?
It doesn't
Can
hurt
you
at
feel
all.
anything? No.
No.
You just feel that it's probably quite cool to start with.
Yeah, it's
and then it warms up.
Okay.
Totally painless.
Okay. And so, we're talking about, ways to avoid painkillers. That's a big thing that is happening, obviously, with issues of, addiction to painkillers such as opioids. So this is a good drug-free alternative for people who are dealing with chronic pain or injury, but don't necessarily want to go down that sort of pharma route.
Absolutely. So I can because we're targeting all the cells in the body, I will also treat, as well as localized pain, I will be treating down the spinal column, which is going to target those nerve and pain receptors that feed into the brain. So we can cut, and this is what I'll be doing now, the nerves that run from the site of injury. We'll be then treating them to, reduce that pain significantly.
Okay. And so what can people expect in terms of, treatment length? Like how many, I know obviously how long is a piece of string, it depends on the
It's so
injury.
difficult because everybody's different and everybody will respond slightly differently.
Yeah.
And it depends, where the injury is.
Sure.
You would generally start to feel the benefits within a few days.
Okay.
You need to keep on top of the treatments initially.
Yeah.
Yeah, so I would recommend we put a plan together. It'd be a very personal plan for that individual.
Yeah.
And then we just try and work it, ideally a couple of times a week to start with, then weekly, and then we would space it out.
Does laser therapy work in conjunction with other treatments, and if so, which treatments does it work particularly well with?
There aren't any other treatments that it wouldn't correspond and work well with.
Okay,
And,
brilliant. And that includes pharma as well, doesn't it? I mean, that also includes painkillers.
Yes, of course.
Just trying to, bring something out, to have that balance. So if you do have any questions for Emma, then you're welcome to email her, emma@seedwellness.co.uk. And if you have any other questions, then you can also email info@seedwellness.co.uk, and we'll endeavour to answer all your questions. Thank you so much, Emma and Mark, for joining us today.
Thank you.